I'm going to demonstrate the proper donning of sterile gloves. Now, prior to the donning of the gloves, you've cleaned your hands with the betadine solution, you've scrubbed everything, you've taken off all your rings, watches, tattoos, whatever you have, and you basically clean up your elbows with the betadine solution and rinse it off. At that point in time, you come back, you keep your hands away from contact with tabletops, things of this nature. You will have an assistant that will basically get your sterile glove. They come in individual sizes, remember, for sterile gloves, and you will be sized as to what size gloves you actually wear. And there's actually a right hand and a left hand. These come in latex or non-latex. They come powdered or unpowdered, depending upon what your preference is. So what you typically do is then your assistant will open this up for you, peel it back. This is sterile, so this piece of paper inside, which contains the gloves, is sterile. I'm going to basically handle it, keep the outside. I'm going to open this up. Notice it has the size and the name of the glove. I turn it around so it's facing me. When I open this up, it shows two gloves. On the inside, the size of the glove, and notice that the thumbs are typically laid out inside of here with the thumbs to the inside, always to the inside. So when I turn this around and face me, the gloves are laying like such, with the thumbs laying across like this, with the sterile material. I can open this up now. Again, I'm not going to contaminate the gloves by opening this up. I pop this open, okay? And if I'm careful in putting on my gloves, the inside area here, which is sterile, can be used as an additional sterile field for your surgical procedure. Okay? Putting the gloves on, you can start with either the right hand or the left hand. It makes no difference, whatever you're most comfortable with. But as you can see, the thumb is kind of hanging over here, and the thumb is over here a little bit as well. Okay? So what I'm going to do is I'm going to start with the right glove. Because my hands are clean but not sterile, I don't want to touch the finger portion, which is going to come in contact, or the palm, which is going to come in contact with the actual patient. So I'm going to grab the cuff. Notice the cuffs are turned up. I'm going to grab the cuff at the base because this is going to flip over, be laying against my skin. I then insert my hand, put the glove on, and if your fingers don't always get in exactly the way you want to, that's okay. You can correct that later. So this is my first gloves on. Notice the cuff is still turned up. I'm going to leave it like this for now. So this glove, this is a sterile area. This area down here is not sterile. So I'm going to turn over and reach over and grab the other glove and insert the other glove. If I put my hand down here, like I did the first glove, there's a chance it can contaminate with my hands. So here I want to take my fingers, put it inside the cuff, like such, to support it, lift it up, and then insert my hand in here, making sure that my fingers, this glove was rotated the wrong direction. This does happen. Okay, we'll do that. Reach inside here, pick the glove up, slide my fingers in. There's my thumb, slide it on over my hand, put the glove on. Now that I have both sterile gloves on, I can adjust my fingers so they're fitting properly. I can reach here at the top of this cuff, put my fingers inside, and pull the glove all the way up. And this is now my sterile gloves. What I'm looking for in the gloves is there should be no wrinkles on the glove surface. The fingers should be appropriate distance. There shouldn't be any bagginess in here. In some cases, some fingers are longer or shorter. You may want to look at different brands of sterile gloves to determine which is best for you. They do vary somewhat between the brands. But notice there's no wrinkles. Notice there's a little pocket of air in the center. And when I relax my thumbs, my thumb should kind of pull to the center a little bit. You want the glove snug without wrinkles, so it doesn't catch on the surgical field or any instrumentation you have. But if it's too tight and too restricting, it's going to tire your hand after a while. But this is kind of pretty much what we're looking for on the sterile gloves. To remove sterile gloves, it's a pretty simple procedure for removal of sterile gloves. Since these gloves may be contaminated with blood or bodily fluids, I do not want to touch any of the material from the glove onto my skin. So I will take one glove. And usually what I also do as well is anything I have with blood on it, I will typically pick it up, wad it up, put it in the palm of one of my sterile gloves like such as my bloody sterile 4x4s, et cetera, et cetera. Then I'm going to reach here. I'm not going to reach down here to take the glove off because that could contaminate my arm. I'm going to reach in the cuff area, pull the skin up, take the glove off inside out, And notice now all my bloody stuff is inside the latex glove, which gives me a 1 layer of protection. I then take that glove, put it inside my other glove, then here I reach with my finger underneath and then pull this glove up and over. And now anything that I have from the surgery that has blood on it is now contained by 2 layers of plastic or of latex, depending what you have. And then I will go ahead and wash my hands following the procedure. You always want to wash your hands after a minor surgery procedure, whether the gloves broke or not. Just always make sure you wash your hands.